Thank you. Thank you, Virginia, and good afternoon, everybody. It's truly an honor to be here with you today. Thank you all for attending this very important summit that concerns an issue that impacts the lives of millions of American women, men, and their families: autoimmunity and autoimmune diseases. And if you're sitting there thinking, well, it hasn't touched mine, I'll bet that all you have to do is scratch the surface and you'll find that it has. That's certainly been the case with me. I'm here today as a sister, a daughter, a wife, a mother, a woman, and a friend. I'm here first and foremost because my dear friend, Kellie Martin, and the trauma she and her family experienced just over a decade ago when her beautiful 19-year-old sister, Heather, died suddenly from an undiagnosed case of lupus. Just 6 years ago, I had no clue what lupus or any other autoimmune disease was. I had just celebrated my wedding and was in the process of making new friends. Kellie and I became fast friends. I mean, how could we not? We both grew up in the entertainment industry. And as Kellie and I grew closer, she revealed Heather's story to me. She told me that a few days after finishing her sophomore year at college, Heather couldn't get out of bed. The doctor said it was the flu or possibly just stress from recent exams. They were told to wait it out, that the virus must run its course. 3 emergency room visits, and 3 days later, the doctor finally admitted Heather for observation and testing. A few days later, she was told that it was indeed a virus and released. That was a big mistake because Heather's undiagnosed case of lupus was wreaking major havoc on her health. She finally did get a correct diagnosis, but sadly, it was too late. Heather's story absolutely devastated me. I'm the oldest of 8 kids, 7 of whom are girls. All through my life, I have thanked God for keeping my family safe and healthy, unable to imagine my life if I was ever to lose one of them. So to learn that my close friend had lived my fear made me want to instantly get to know more about lupus, but also to let Kellie know that I was there for her as a friend and I would try to help in any way possible. I attended a Lupus LA event along with Kellie, came to realize the room was full of familiar faces. Like I said, once you start to scratch the surface, I was suddenly hit with the realization that many of my friends had been affected by this affliction in many ways. I remember seeing my friend Kelly Stone, Sharon Stone's sister, show up at a Lupus LA event a few years back, announcing she had been diagnosed with lupus. And then there's Adam Silkowitz. Adam is a dear friend of mine who is the president of the organization I work closely with, Lupus LA. He's also living with lupus as one of the few males diagnosed with the disease. Adam is close friends with Howie Dorough, who you may know as one of the Backstreet Boys. Howie had also lost his sister as a teenager to the illness. I became friends with Adam while working with Howie, and we got to know each other in social situations. But I now had someone that could really help me understand this mystery of a disease, since I tiptoed around the topic afraid to stir up feelings in Kellie that she may not feel comfortable sharing. It's not easy to see my friend Adam take his plethora of pills before meals or hear him talk about his struggles with his lungs as we went on high-altitude trips. I watched him kick his caffeine habit in order to breathe a little easier. Seeing so many of my friends being affected in different ways by the same autoimmune disease made me want to get involved, and that is why I'm here today. I'm here because I want the rest of the people in this country to know that autoimmune diseases constitute a major U.S. health crisis, that autoimmunity is the underlying cause of more than 100 autoimmune diseases. I want people to know that more than 50 million Americans suffer from autoimmune diseases, mainly women, and that the prevalence of these diseases is rising. In comparison, cancer affects 9 million and heart disease up to 22 million. And I want people to know that collectively, autoimmune disease is one of the top 10 leading causes of death in children and women under 65 and represents more than $100 billion in annual direct healthcare costs. Yet fewer than 13% of Americans surveyed in a recent AARDA poll could even name an autoimmune disease. I know I'm preaching to the choir in some respects, but I do think it is a responsibility of each of us to get the word out and educate the public about these diseases. One of the reasons I'm speaking at the end of lunch rather than before is because I spent the morning over at the Associated Press Broadcast Center and News Channel 8 doing interviews about this summit today. One of the things I feel passionately about when it comes to these diseases is getting an early and correct diagnosis. I know that's a belief Kellie and I share because of her sister, Heather. I'm told that because there are no known causes or cures for autoimmune diseases, the key is getting a correct diagnosis, which in many cases can take years upon years and multiple visits to multiple doctors. That's a message we must get out there. Compared with many of you, I'm new to the autoimmune disease cause, but I thank you all for your commitment, and especially AARDA for the work it has done in less than 20 years to bring a national focus and collaborative research approach to these diseases. I applaud your efforts for all the work you do to educate the public, support patients, and engage in research that will hopefully one day eradicate these diseases. Thank you for inviting me today. It's been a great pleasure to be here, and to everyone here I say onward with purpose.